Hello and welcome to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm excited that you're here. And I'm excited because we have not one, but two amazing guests today on the podcast, Cheryl Wellman and Courtney Mead of SPS Dental Academy. They have a combined experience of over 35 years in the dental field. Cheryl and Courtney joined SPS Dental Academy to create online training programs addressing staffing needs, and challenges within the dental staffing industry, which are massive right now, obviously. Their courses range from beginning to advanced, helping team members excel in their roles and offices achieve exceptional patient care. Thank you both so much for being on the podcast. Both have a wealth of experience. So, what motivated you to go from delivering patient care to delivering training to dental teams?
Go ahead, Cheryl.
I decided to do this because I've gone through tons and tons of training myself and just noticed the lack of cohesiveness in the trainings for the dental team members. Everybody has a different idea. So we're just trying to make things a little more systematic. Not only does everybody have different ideas, but based on the staffing shortages happening right now, people just don't have time to train.
Courtney, what got you into doing training
Mm.
versus seeing patients?
I personally have been in the situation where a lot of these new people to dental have been in. Um, I've been thrown to the wolves and basically said, sink or swim. And obviously I swam, but it was very difficult. And I don't want anybody else to have to go through that because it is very scary. You're talking about insurance and you don't want to be the reason that a doctor gets fined. So it was a little scary and I don't want anybody to go through that.
It's You bring up a great point, and I want to highlight because we have a lot of leaders in dentistry that listen to the podcast and dentists. When I joined Circuit City to be a computer salesperson, I had 2 weeks of training without seeing anybody. And how much training do we take when we bring in a clinical member and then have them see patients where we're doing procedures that we're getting measured in nanometers, right? And so having those
Correct.
procedures, it's vital. So at SPS, you do a lot of training for team members. So how do you bridge that gap from essentially, like you said, Courtney, getting thrown in the deep end and saying, figure out how to swim? And these are a very high paced dental practice using massive computer entry, data entry, and CAD CAM scanning and all sorts of things. So how do you bridge the gap?
So what we do is we start from the very beginning, right? So the very basics. We personally, as an office manager, I would always hire off of personality, not skills. There are obviously specific roles in the office to where you have to have certain skill set. But when it comes to training, even a new dental assistant or a front desk team member, you need to hire off of personality because that's something you can't train. So if you hire the right personality, we can fill in the skills. And like I said, we start from the very beginning, how to, as simple as how to answer the telephone to talking about treatment with patients and navigating their insurance. So we want to go from the very beginning all the way to the end.
That's great. I want to highlight something here. I think one of my roles as a podcast host is to pause and highlight things that people say that it's easy to gloss over. And you said we train the basics, and it sounds like basics are not as important as advanced. Now, I was a martial artist, and I firmly believe that if you master the white belt, like that's all you need. The rest of it is extra fluffy, nice stuff. And the same thing is true. You guys can correct me or just validate what I'm saying in dentistry. Sitting people up, looking them in the eye, having a conversation with another human being as if they're another human being is a very basic human skill that if you don't get that, nothing else happens. But
Correct.
very few practices actually do that because it's fallen off because the basics get overlooked. In fact, I would guess that it wouldn't be a bad idea to even have your. I just wrote a bonus check to a dentist that is a associate at my practice for over 10 years today. Probably wouldn't hurt for her to go back and watch those basic things every year just because the basic things are probably the most important, and yet they're the easiest to overlook. Much like what you said about hiring for attitude. everybody says they want to do it, but then it's like, oh, this person has experience and whatever. It's just going to be easier. So I would
Yep.
also highlight that piece too. If there's SPS Dental Academy out there to do the training for you, you have to do it. All I have to do is have them hit play on the computer. Why wouldn't you hire for attitude? Right.
And not only
Right.
that, Dr. Laskin, not only do they hit play, but we've had really great success in the follow-up with them. So we do also one-on-one sessions once they take the trainings so that they can implement and then move forward. And we're there to help them walk through the process of something that may not have worked for them or maybe what they missed on the training. And we're there to walk them through that process, answer all their questions, help them do whatever they need us to do.
So what type of trainings do you have that you would say, okay, if these are the trainings that the average dental team needs to take?
They range anywhere from patient communication all the way treatment plans, telephone, and then we dive really deep into insurance. So we do coordination of benefits, the coding. So we have a
Case
little bit of everything.
the case
Yeah.
acceptance as well, because I think being patient centric is so important. You have to make that connection with the patient. Just like everything else, that's where your relationships build in everything that you do. If you don't make that connection, you've lost that patient.
Yeah. And I think going back to how we started the podcast too, this case acceptance comes down to trust. And
Correct.
trust comes down to not just you, but your team and how you
Correct.
work with your team and how you work as a team. And that's where I think dentistry has really gone to switching from an individual sport, this is what the doctor says, and I'm just going to do it, to having a team approach. Because we all know, if we're honest with ourselves, that the first thing if you as a dentist recommend treatment, when you leave the room, the very first thing the patient does is look at the team member and say, do you agree with that?
Or what did
And
he
so,
say?
yeah, yeah,
Yeah, that.
exactly.
What did he say?
That's a whole nother can of
Yeah.
worms, right?
Yeah.
Which at that point you might as well just put a big L on the board.
Yeah.
So what do you see are as the biggest, so the low hanging fruit for practices to incorporate starting tomorrow?
Patient
Mm.
communication and insurance verification, I think, are the two biggest takeaways from this. Having everything done correct from the beginning helps you not have to chase on the back end. If we get it right in the first place, we train everybody how to get it right in the first place, then we don't have to do all the runaround on the back end and take all the time from that. And patient communication, how to have a conversation with the patient when the doctor may be running a few minutes late. Or if the patient is late, what are the protocols and standards? We've got it all, doc. And it's all about the patient and how do we connect and what do we do to make it right?
Yeah, I feel like the it's obvious right now. Everybody's talking about how the every practice has doesn't have enough qualified team members,
Correct.
and so we can you can just complain about it, or we can do something about it,
Correct.
right? One is to find and attract better employees. And the way you do that is probably by leveling up your existing employees and your team members, and through doing trainings like with SPS. Another is to automate things, like you were saying too. I mean, I think
Correct.
there's so many things we can do in dentistry where if we spend 100 or $200 a month, we can have more consistent, better results than if we have somebody do boring, mundane, laborious task, like sitting on the phone for insurance verification. I mean, that's
Correct.
just in the year 2024, it's wrong to even have a human do that.
It
It's almost
is.
like it's unusual punishment for being in a sitting at behind. And then we have the new patient come in, look at that person who's sitting on the phone and be like, oh, what do I do
What
with
about
my
me?
forms? Yeah, exactly.
Well,
Exactly.
you bring up a really good point though, Doc, about that $100 or $200 a month. Think about how minimal that is compared to having to hire two or three more people to get this work done. If we have all the systems in place, our training, your platform for the patients to be able to communicate and work with the team. It takes a load off the front desk, which makes a happier team for sure.
Yeah, and let's just have the reason why most of us go into dentistry is because we wanted to work with people, right?
Correct.
And so having the systems that allow you to focus on the people in the practice is what's going to elevate case acceptance and all that. And I think team training, in my opinion, is one of the most under leveraged pieces that we can do for our practices. I
Mhm.
feel I go to, you see the team members that go and get training or go online and work with online training. Yes. And those practices just work. And the ones that think that they don't need to have training, that's where things fall apart. And the first thing that happens that I've seen when things fall apart is they go, oh, what kind of training do we need? Well, why would you let it get to that
To that,
point, right?
correct. Correct.
Human nature is entropy. It's like go off track. If we
Yeah,
consistently, and then the beautiful thing too about online training is it's going to be consistent too. So everybody's hearing the same thing every
correct.
time. And it's just, I think it's great what you're doing.
And
Uh,
thank you.
yeah.
We
So how
love
can
it.
people, yeah, it must be very rewarding to hear
It is.
stories about teams that turn around.
I'll tell you, we're
It
working with a
is.
practice right now, and both of the front desks had never had any dental. And just to watch the growth in them has been just truly amazing. And what a blessing. They've continued training with us because they feel like we're part of the team now. So they continue to add training with us because they want us to join them once a month just to have conversations with them.
And there's this aspect of dentistry that we don't talk about very much that all three of us are part of, which is excelling in a role in dentistry. So then being moved to a different role in dentistry
Correct.
and not having any training, right? Like suddenly it's that assistant is a great assistant. So let's have him or her be an office manager, right?
Yeah,
Totally different skill sets, right?
it is. It
So
is.
how are we? And that person barely got trained to be an assistant. So how do we expect them to be a good office manager? And that's happening probably in to some degree in every dental practice that's listening to this right now. People are being
Yeah.
shuffled around because oh, Betty left. Let's get Sue to do that. How are you going to get? How's that going to actually happen? Right?
And what's that going to look like? Yep.
Yeah.
Yeah.
So for team members that are listening and people that are that want to level up their training, where should people go to learn more about SPS?
Definitely our website and spsdentalacademy.com. And then follow us on social media too. We put, when there's a new training, we put stuff out on social media. And again, that's just SPS Dental Academy. We have Instagram link, obviously. So yeah, it's great. We offer a free training as well on our platform, just so that everybody can get a taste of what our trainings are like, because it's not somebody just talking to you in a PowerPoint. It's actually interactive training to where you're moving through it. There are voiceovers, there are videos, there are matching games. So it's very interactive, and we try to engage the learner because nobody just wants to sit there and read or be talked to for an hour.
Yeah.
Well,
However, for about 15 minutes, they'll listen to something,
well,
Yeah,
and that's
exactly.
but that we did do that, Doc. We tried to get as much into as a minimal amount of time to get them to understand it because they do shut off after a certain point. So we do try to hit the main points right away with these trainings.
Oh, it is very important. I've been subjected to trainings where it's not even a human being; it's a robot talking to you while a
Yeah,
slide deck goes by.
yeah,
Oh my gosh! And then
yeah.
Yeah.
they make it so you can't go skip ahead or whatever because it's just so painful to watch. And yeah, yeah. So thank you for making it exciting and interesting and fun. And everybody
Yeah.
can go to spsdentalacademy.com to try out the free course, see what it's like, and get your team trained up. Yeah, I don't know why you wouldn't. So, Cheryl, Courtney, thank you so much for being on the podcast. Appreciate it.
Thank you, Dr. Laskin. We
Yes,
love
thank
joining
you.
you.
Thank you.
Have a great day.